The first be recorded, so if you're nervous about being recorded, you could probably click off now. The second thing is, to all the people who are Skyping in on the phone, if you would please go ahead and mute your phones using *6. That would be greatly appreciated.
They should already be muted.
They should already be muted. And at the end, when it's question time, you can unmute yourself by using *6. Is that it? Am I?
Yeah.
Okay. That's all the IT intro-y things to do. So I'm going to start with the other introductions. I am Nancy Kaplan. I am the program manager for the Ladies First program here in the Health Promotion Disease Prevention for the people who are on the phone. WISEWOMAN is one of my 2 programs that I run, and I'm going to introduce me. Patrick Kinner, who is the Director of Evaluation in HIPDIP, Health Promotion Disease Prevention, and Allie Johnson, who is the Cancer Registry Chief in the Department, the Health Surveillance Division. So the 3 of us, plus a few other people who I'll introduce in a minute, have been working for a long time on this economic evaluation project, and here we are at the end, well, still in the middle, I think. So, anyway, without further ado, we will start. This is one of the second housekeeping things. So there are 10 essential services in health, in public health. What we are showing you is essential service number 9. Evaluate effectiveness, accessibility, and the quality of personal and population-based health services. So what this means is you should do evaluations. That's really the bottom line. I want to get my thumbs up. The objectives of this discussion today is to A, learn about the Ladies First program, that's just a little piece of this, and how it is evaluated. The second, which is really the bigger nut, is to see how a cost-effectiveness study was done and see what the results say. And the third piece is to really understand the value of economic evaluation and consider applying it to other programs within our department. I'm going to whip through these acknowledgments. You can cheer or not cheer if you see your name. I'm pretty sure there are folks from CDC on the phone, so I will call out these specifically, that Jack Chappell and Julia Jordan, who were part of the evaluation services at CDC, and Diane Mannheim, who is our program officer, also down in Atlanta. EBPH faculty, Karsten and Carol, if you're on the phone. And our study team, who I won't embarrass, just raise your hands over here. If you were on the study team, thank you very much. And so a quick little shout out to the workforce development group here in the department. So I'm actually the HIPDIP representative to workforce development. And as probably many of you know, we are always proselytizing about what things you should know in addition to your regular day-to-day job. One of those things is evidence-based public health. In addition to that, the biggest piece of that, I think, is that we do evaluations. We're really doing this big push in workforce development to make sure that everybody here understands what evaluation is, why you'd want to do it, and why it matters. And so this example, this whole presentation, is the why it would be important to go to those evaluation training meetings and know how to do this yourself. So, quickly about Ladies First. This is the blah, 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 blah stuff. Ladies First is a federally funded, CDC-funded program. We have 2 CDC funding sources. One lives in the cancer world. We offer breast cancer and cervical cancer screening to low-income women in Vermont. And on the other side, this part of the study is we are in the heart disease world. It's called the WISEWOMAN program, which is this really awkward acronym down here. And WISEWOMAN offers the same cohort, low-income women who are Vermonters, access to things like 2 lifestyle programs. We do heart disease risk factor screening So women go to their providers, they get screens, they get an exam, we pay for that exam. Based on those risk factors that they have, which might be elevated blood pressure, elevated blood glucose levels, prediabetes, hypertension, I already said that, cholesterol, and the biggest one, probably the biggest yay or nay to get into one of our programs is BMI. And so if your BMI in our program is 25 or above, you are eligible. And so for those of you in the room who actually know what that means, that's actually a pretty low bar, relatively speaking. Because what the point of all of this is really, it's about prevention, and it's about giving people access to healthy lifestyle behavior options that they wouldn't normally have. So this is what we do. And who is eligible for Ladies First? So you must live in Vermont. For various of our programs, the age range is different. For the WISEWOMAN component, the age range is 30 to 64. 250% of federal poverty level based on household size, just to ground that. For a family of 4 this year, that's around $61,000 of income a year for a family of 4. People can have insurance, they can be uninsured, and they can be on Medicaid for our program. We cover breast cancer, cervical cancer, cardiovascular disease risk factor screening. What we do with that is we do what we call risk reduction counseling. In fact, Siobhan Donegan, right here, is our lifestyle program coordinator. Her job is to talk to every one of these women who get screens, figure out what, using motivational interviewing, figure out what it is that they might be wanting or willing to do, and to help them figure out what's the best fit for them in terms of what would help them the best to reduce their cardiovascular disease risk factors. So what we do in our world, we call screens. So if a woman goes to see a provider, she gets screens. This is really the raw numbers of the number of screens we've done. We are winding down this grant. We are in year 5 of 5. In 45 minutes, I'm going to go start writing the new grant application that's going to come out. So the first year we started, we screened 118 women. Year 4 was our best year because we have started the wind down of this program. We assume if we get this grant again that we will actually bump these numbers way higher than before. In order for a lifestyle program, so lifestyle programs are things like going to Weight Watchers or going to something called, does everybody know what Curves is here? It's a women's only gym. Curves Complete is a gym plus a nutritional component, nutritional counseling component. In order for a program to be approved by CDC, for us to pay for it, we have to do all this paperwork. So you don't need to see this, but it's a lot of paperwork. It's like 5 pages worth of paperwork. Basically, the bottom line is that it needs to be evidence-based. We need to do the research here to show CDC if it's not a national program. Weight Watchers is a nationally recognized evidence-based program. We need to show them that Curves Complete, in fact, checks all the boxes and that we should be allowed to pay for it. I'm going to wait 1 second, and I'm going to say, as the program manager, my job in this evaluation world is to help figure out what it is we have to look at. How is it going to help my program to study something, to study from the beginning of the program to the end of the program? And in this particular instance, what we were trying to figure out is, we have this chunk of money to spend. How can we best spend this money? And how can we be good stewards of the money? And so when you see the data rolling through here, I want you to remember 2 things. To me, at the end of the day, when we saw the final number of how much it cost per person to put a person through these programs, I was like, oh shit, we can't actually show that on screen because it's a lot of money. And what you need to remember is this study in particular was done from the very beginning. So the very beginning of this was the writing of all of this documentation, was negotiating contracts with 7 different curves, providers around the state, and time is money. That is all I will leave you with. So when you see those numbers, please ground yourself in that understanding. And so I get to stop talking, and Patrick Kinner gets to start. Thanks.
So, like all of the health promotion and disease prevention programs, Ladies First has been doing ongoing evaluation for the last several years. Whenever possible, we try to evaluate the 2 programs together. In this case, we chose to just look at WISEWOMAN because we wanted to look at one specific element. A theme that has shown up in evaluation over the last several years is to better understand the value of the program. And usually when we talk about value in Ladies First, we're talking about the value, the meaning, and the benefit for individual members. For this evaluation, we decided to take a more literal definition of value, and we wanted to look specifically at the economic value of the dollars spent compared to the benefits that the members are getting. And so any good evaluation is going to be providing results that will help with programmatic decision making. We also knew that that this study, if there were meaningful results, would be addressing a gap in the literature, in the evidence base. The only economic evaluation of WISEWOMAN that's been done was a study the CDC did about 10 years ago. And so we knew that there was something that we could provide that'd be meaningful. We also know that economic evaluation in public health is something that's happening more and more, but still doesn't happen on a huge scale. So we knew we would be taking on a study that would have some novelty and some value that way. So we wanted to build in the scientific writing component for publication into the design. And so we decided to do that at the inception so that we could do them together in a sequential way rather than trying at the end to figure out how to publish what we wrote. And so the way that we brought the design and the publication together was through the development of a SACO statement. And SACO stands for Single Overriding Communication Objectives. And so think of it kind of as an abstract of an abstract. So you're starting at the beginning, you're putting together what it is you intend to do. So we didn't know whether we would have the numbers, we didn't know whether we'd have adequate cost and benefit data even to say that the study was going to work out effectively or not. But we had to start from a certain kind of vantage point in what we were trying to accomplish, and the SACO statement is that. The only thing that's missing here from a traditional SACO statement is the actual results, since we didn't know from the beginning. So, but this is where this was the initial definition we put together, both for the study and for the paper. And now Allie is going to walk us through the study methods and results.
Great, thanks, Patrick. Morning, everyone. I'm really excited to share the results of the study with you. We simply refer to it as economic evaluation of 2 lifestyle interventions in the Vermont WISEWOMAN program, a retrospective cohort study. So buckle up, it's going to be really fun. I'm so glad you're here to learn about this, and on the phone too. So just a quick disclaimer, we did apply for IRB review for this study, and it was determined to fall outside the purview. So our main study question was, which intervention represents the best investment of limited program funds? So I'm using these 2 bowls of fruit to symbolize, these are 2 options. They're both very similar, they're both very healthy for you, but they do have slight differences. And so we wanted to compare them. There are 9 steps to an economic evaluation. I am going to group the first 3 for simplicity and try to get through the material this morning. So this is the whiteboard. This is where we started. This is what Patrick referred to. We were just trying to get literally on the board. This is where our starting point. And we didn't know where we were going, but over time, we came up with the study design as a group. We came up with the purpose. We identified team members, study phases. Oh, that was intentional, right, Randall? The light's going off and on? Okay. Study phases, we kind of wanted to have it all in the beginning, and then we quickly realized we need to just get a win at first, and then maybe some of the other things we wanted to study would go on to phase 2 or phase 3. We identified data sources. We identified how to select which participants, which members of Ladies First were eligible to include in the study, how we were defining benefits, how we were defining costs, the timeline, and the resources we would need. And this whole process took us 8 months just to design this study. And we wrote 12 drafts of the study design protocol. So I just share that because maybe now that we've gone through it, your program wouldn't have to go through that. You know, we had to learn a lot along the way. We have a lot to share, but it's a big commitment to do this kind of study. So these are the 2 intervention choices that Nancy was describing. Curves Complete has, so these are the definitions of like completing the whole session, going to 10 sessions within the time frame of 12 weeks. For Weight Watchers, it was completing 12 sessions within 24 weeks, so you can see it's a little bit more time there. But it's focused on behavioral weight management. It doesn't necessarily have the exercise and gym component, although the participants could opt into Ladies First paid things like YMCA and Jazzercise. So to be eligible for the program, people had to be an active Ladies First member. They had to have been screened for heart health before the intervention. They had to have experienced the intervention in the 2-year window we were studying. As Nancy mentioned, their BMI had to be at least 25. They had to report some readiness to change prior to the intervention, and they had to have attended at least 1 lifestyle program. Okay, so getting to the steps of an economic evaluation, you have to decide what perspective you're going to use to focus on the evaluation. I was talking with my husband about this leading up to today, and he's from the perspective of private, what is that called? Outside of government business, you know. I have an MBA, I should know this stuff. Private sector. And he's like, oh, you've got Curves Complete and Weight Watchers, and he's like, in marketing, he's thinking, oh yeah, you know, and he's thinking, well, okay, so the story is going to, there's a clear winner. We'll get to that in a minute. But he knows the punchline. He's like, oh, you could put this in a press release. And I'm like, no. The costs and the perspective are all about the public health agency. This is not we didn't do it at the perspective of the participant, the center one there, where it's just the cost of membership. We looked at, as Nancy was saying, money is time, or time is money. We looked at all of the costs that, as a health department, we experience when we're administering this kind of program. So then we had to select the specific, you know, one of 4 types of economic evaluation selected, and we picked cost effectiveness because that's the one we could measure. So cost effectiveness measures the cost in dollars and the benefits in naturally occurring health units, like lives saved or quit smokers. And so the end result is dollars per life saved. And I find it a little counterintuitive that a lower number is a better result. So I just wanted to talk through that quickly. If you have a study where the result is $10,000 per life saved versus $20,000 per life saved, the less expensive one is the more cost-effective one. Okay, the data sources we used were WISEWOMAN personnel records, so that's just sort of who is doing what job when. The health department, and thanks again to Karen Kelly for providing the EMP cost and hours worked reports. We wanted to show you could do this with just data that the business office, we didn't have to ask them to do a special vision query. We use these readily available business office reports that Nancy uses routinely to manage her grant. And then we used HIPDIP business office paid invoices to look at things that we paid for, like gym membership. And then for benefits, Ladies First uses a very robust system. It's a commercial off-the-shelf solution, and it has information about people's eligibility, their active membership status, demographics, their participation in these interventions, and health information related to where their heart health is, where their weight is. It's a very rich system, and I'm saying that from a cancer registry manager perspective, and I'm like, wow, that's awesome data. Okay, so we only so this study is based on relatively small numbers. 56 people participated in total, and 30 of them completed one of the 2 interventions. But we did try to recruit participants for 2 years to try to mitigate the challenge. I mean, we didn't want to wait another year of data collection before we got the results out. So here's just the basic descriptive statistics of the study population. Many more women participated in Weight Watchers than curves. The BMI range of the participants was pretty evenly distributed among the 4 classifications of overweight and obesity, obese class 1, 2, and 3. Most of the participants were at the action stage of readiness to change, but we did have some participants who were not quite there or maybe further along in their readiness to change. And then most of the participants were aged 40 to 59, although we did have some under 40 and over, and 60 and over. And then the race makeup of the people who participated in the interventions was pretty similar to the membership of the Ladies First program. Okay, so step 4, we're going to measure costs. And costs are divided into two types: intervention, where we look at memberships, incentives, and fitness membership fees, and then personnel, so that's salary and fringe. Okay, so now on the intervention side, we're going to look at membership first. For Weight Watchers, we looked at the cost of meeting vouchers used. And just to quickly explain how this works, members get a set of vouchers, and they're so sweet. If they don't use them, they send them back to Siobhan. And so the Weight Watchers costs were really tied to the level of participation in the intervention. And then we collected costs for membership of other things like YMCA and Jazzercise. So in Curves Complete, the way the contracts work is for Ladies First members to participate, Nancy has to pay for everybody to just participate in a 3-month paid membership up front. So a member could go 1 or 2 or 3 times. That membership is paid. There's no way for Curves to return the unused portion to Nancy. So that becomes a little important later when we look at some of the, when we can start comparing the costs between the 2 programs. Women received incentives for getting along certain milestones in the program. So for Weight Watchers, they received a points calculator for attending 6 sessions. And when they completed the intervention, they got a cookbook. And for any member who participated in something with a fitness component, like Curves Complete or Weight Watchers with Fitness Group, they received a sports bra for beginning, and when they completed the intervention, they got a sporting goods gift card. So now we're on the other arm of costs. We're on personnel. So to be eligible to go into our little spreadsheet, the dates worked would have been in the 2-year range of the study. The personnel time would have been billed to one of the, I believe, 4 Wise Women program codes, and we looked at salary and fringe. And this is what everyone looked like the whole time we did the study, right? Merrily walking along. All right. And I'm sorry to make this a little complicated, but I just want to explain that, there are a lot of decision points for this kind of a study. It started out like this, but we got it a little more organized. So we focused on the four positions in the program. They changed the people over time, so those are the 4 positions that influenced, and therefore their costs were attributable to the study. So thinking about that Wise Woman cost report, some people do other things beyond Curves Complete and Weight Watchers for Wise Woman, and that time gets billed. So we had to say, okay, how much for Hip Dip Evaluator, Patrick, how much of your time billed to Wise Woman gets spent on these 2 things, Weight Watchers and Curves Complete? And Patrick said 60% of my time. Okay, then between Weight Watchers and Curves Complete, is that a 50-50 split? In Patrick's case, yes, it's equal. But you can see, like, for the data manager, Matt, he spends less of his Wise Woman time specifically on these 2 interventions, and his Weight Watchers and Curves Complete time is not 50-50 because more people do Weight Watchers, so more of his data management time is devoted to that side of the house. And then we have the LSP coordinator, Siobhan, and the program manager, Nancy. And you can see Nancy's time, 80%, and Curves, I think a lot of that is the startup phase that she described earlier on. Okay, then nobody stays in the same position for 2 years, well, except me. Okay, I've been here a little while. But so this is anonymized, but it shows who was in which position at which time. We needed this to go back and figure out, once we had those MCOST reports, like, okay, it lists a name, but what position were they in, and to figure out how much of their time was attributable to what. Okay, so let's take through an example. In order to calculate a salary for a specific intervention, you start with the salary billed from that MCOST report. You multiply it by the time they spend on either of the two interventions, and then you multiply that by the fraction of time they spent on either Curves Complete or Weight Watchers. So I'm going to pick on Matt. In quarter 3, 2016, Matt Mayberger billed $4,600 to the WISEWOMAN program. But we know only 1/6 of his time is spent on these two interventions. And then to look at Curves Complete specifically, he only spends 1/3 of his time on that one. So of that, we put $256 of Matt's time for that quarter in the Curves Complete bucket. And then we did the same thing for fringe costs. So this is a simpler picture that just shows, wow, the human component of this and administering the program is the big piece of the pie here. So labor and fringe represent 84% of all of the costs that we looked at. Membership is a big piece, and then some incentives and additional fitness memberships are little tiny slices. So to show you the results, you can see we have the intervention and the personnel costs in their two categories. And at the bottom, these are the numbers Nancy was concerned to show, the average cost per participant. Looking at labor, again, this is another way of showing it's an important cost driver. And even when we added this fitness cost for those Weight Watchers participants who were getting gym membership help, we added it, but it's still lower cost overall than Curves Complete. Now we're going to move on to benefits. And what do we mean by benefit? In this case, we're talking about the positive impact from an individual participating in the intervention. We have all kinds of labels of benefits in the health department and the agency, but this is, for this study, specifically what we're talking about. So we originally wanted to look at 3 approaches to benefits of the intervention. One is the percent of people completing the intervention. Like, we thought that would be a win we want to capture. The other was meeting the weight reduction goal. And in both cases, Weight Watchers and Curves Complete, it's a 5% body weight loss goal. So that was nice to compare. I had the not so good idea of thinking, well, if women got to be goal BMI at the end of the study, wouldn't that be great? But you could see going into the study, the women were in those 4 categories, and so their BMI, many of them was so far from a normal BMI or healthy BMI, they just didn't have the time within the intervention to get there. So we had 2 small numbers, and we won't be showing those. But the purple data for this study, to simplify, is always going to be Curves, and the blue will always be Weight Watchers. So you can, if you have trouble reading the legend. So this shows the benefits. On the left, we have participants completing the intervention, and on the right, we have participants meeting the weight reduction goal. We didn't find any statistical differences for the benefits. So that kind of goes to Nancy's point earlier of these are effective interventions. They're both effective interventions. Now we're going to construct the cost-effectiveness ratio. So we're just going to compare the cost to the benefit. For the cost, again, we're going to add those 2 types, intervention and personnel cost. And we're going to do this a couple of different ways. We're going to do it once for who completed the program, and once for the other benefit we looked at, who met the weight reduction goal. Okay, a little bit of a problem. So we found this confounding effect where the Weight Watchers, the program itself is about behavioral weight management counseling. It doesn't have a fitness component, but we know you have to exercise to lose weight, and we knew these members were doing some exercise, and we were paying for some of it, and so we were worried that, the Weight Watchers would come away looking a little better than it should because people were exercising, we were paying for it. So we tried to include the costs that we could to related to that, and another way we addressed this confounder was to just show 3 groups. So we're going to show, in some cases, Weight Watchers overall Weight Watchers without fitness and Weight Watchers with fitness. We're just thinking about apples to apples comparison. The Weight Watcher with fitness is probably most comparable to Curves Complete, but not everybody in Weight Watchers is in that with fitness group, so we had to kind of show it a few different ways. Okay, we weren't trying to pull a fast one, but it would have been fun. So this is the big reveal. Again, the purple is Curves, and the medium blue is Weight Watchers overall. The light blue is Weight Watchers without fitness. The dark blue is Weight Watchers with fitness. So on the left, you see the cost effectiveness ratio, the dollars per participants completing the program. And on the right, you see dollars per participant meeting the weight reduction goal. Again, those two benefits we looked at. And we found that for completing the intervention, Weight Watchers overall and without fitness was statistically lower, so better cost effectiveness than Curves. But again, Weight Watchers with fitness and Curves are pretty similar, no difference there. And then for meeting the weight reduction goal of 5% within the intervention time, we found that all of the Weight Watchers was more cost effective. That was it. That was a big find. Clear winner. So this is just a narrative way of showing what the picture showed. That, I'll just let you read that. I know some people are visual like me. I like the picture, and then some people like it in writing. Okay, so we're on step 8. We're getting there. We're going to do a sensitivity analysis. That's my little joke. Okay. So we're not talking about the sensitivity when a dentist sticks something hot or cold into your mouth, although I can really relate to that. We're talking about determining how robust the analysis was. So we found this really important. We thought like really statistically significant finding, but we were a little worried we had the small numbers, and so like how robust is this? So we conducted a sensitivity analysis. And what you do for a sensitivity analysis, and I had to learn this from my workforce development and evidence-based public health, is you vary the estimates and assumptions to see how robust the findings are. You can test different key parameters. You could try putting in different values and putting it through the calculation and see what comes out. In our case, so we knew personnel was an important cost driver. So we thought we'd play around with those personnel assumptions a little bit and test them out and see if we still got those statistically significant differences between the different intervention arms. So one scenario was, okay, we're just going to assume personnel costs for Curves Complete and Weight Watchers are the same. One scenario was to model a more labor-intensive phase like the startup of a program, thinking how comparable would these results be to other programs, and how meaningful would this be to other WISEWOMAN states? They might be in the startup phase, so we'll model the startup phase. And then we looked at total staff time decreasing by 5%, thinking that's more of a maintenance phase. And so we put these 3 scenarios, times the different cost effectiveness ratios, and basically we found that the conclusions held true. Except one of the models, Curves Complete wasn't different from Weight Watchers Fitness for that meeting the weight reduction goal when we assumed that personnel costs were equal. But we know they weren't, but if we assumed they were, then we would find a difference in the cost effectiveness. So 9 of 9 for my part of the talk. Once we have this ratio of however many dollars per participant completing the program, and what does that mean? How do we know if it's like too hot, too cold, or just right? There are a few ways you could do it. You could rank the different options from the lowest to the highest ratio, like the most cost-effective to the least cost-effective. If I were a consultant, I could recommend to Nancy that she start spending on the most cost-effective one and then when that possibility is exhausted, all the members have participate that want to participate in that intervention have, then she can go on spending to the less cost effectiveness one. I'm not a consultant, so I didn't make that recommendation to Nancy. So I'm going back to the study question that we started with. Which intervention represents the best investment of limited program funds? So if you look at the achievement of weight reduction goal, it was Curves Complete cost 5 times what it cost for Weight Watchers. Now, we attribute that to being basically, Weight Watchers was a much more, administratively, it was much easier to administer, and so it took less time. You know, the women could send back those little coupons, which I'm not sure how much, because personnel is such a big cost driver, I'm not sure how much we really saved there, but it's just like lower tech, and it's effective, so then it's more cost effective, and that's kind of what we found. You know, we know that we have some limitations with our study, especially this study's under review. This is real. Knock on wood. So we had to be real about our limitations. We know we're a small state. This study is limited to low-income women, so if you were looking at women in general, what we found might not be comparable. Selection bias is involved because we didn't randomize participants, ladies first members, to different interventions. They were invited to just do whichever one that was best for them. Geographically, Weight Watchers venues are pretty evenly distributed throughout the state, but there's a smaller number of Curves gym, and so they're geographically concentrated. So if there's something about that area of the state with weight loss, you know, we wouldn't have caught that difference. We noted that more time is allowed in Weight Watchers to achieve the 5% weight loss goal. Is it 24 weeks versus 12 weeks, I believe? We combined personnel costs for startup and maintenance phase, so that all that expense of getting the contracts for Curves Complete is lumped right in with the easy, we're just going to do the monthly invoicing during the maintenance phase. So we kind of knew that was a limitation, but it was the 2 years of information we had to work with. And then Weight Watcher costs excluded personnel costs attributable to fitness administration. Another way of saying that is, if a woman using the Weight Watchers option wanted to go to the gym, we captured the cost of the gym membership, but we didn't capture the cost of Siobhan managing that gym membership, or Nancy approving the invoices, for example, or Matt typing in the data, or Patrick writing the SACO statement. No, I don't know. Sorry, terrible way to end, Patrick. Back to you.
Thank you very much, Ellie. So Ellie did a very nice job of walking through how you go from the beginning to the end and how complex an economic evaluation can be. Really, to decide whether or not you want to do a study like this, there's a few required elements that you have to have in place. And defined costs, defined outcomes, obviously the ability to do the analysis, and whenever possible, an external standard. So that part's pretty simple. If you have those things, then you can certainly consider doing an economic evaluation. All evaluation is better when it's done with a team, so you definitely would like to have a group of people that have expertise in different areas supporting the work. And then we really relied heavily on the technical expertise and technical assistance that the CDC provided. We can go a certain way on our own in understanding what the best decisions are to make around what costs you have, what costs to include, what costs to exclude. But having someone outside the study, especially someone who has done this kind of work before, is really very helpful too. And so if you were thinking about whether or not you wanted to, whether an economic evaluation would benefit your program, these are some of the questions that you would want to consider. And I think the last one is especially important. We can always do a better job touting the value of the work that we do. And an economic evaluation provides you very specific and important ways of doing that. I think when you talk about the dollar value of your work, where dollars are well spent, this is something that resonates with all of our stakeholders and something that anybody can understand. So having this particular kind of information about your program is something that you can share with a pretty broad range of people and expect a pretty strong response, a pretty positive response. So that's everything we had to present. Are there questions for us? *6 for those of you that are on the phone to unmute yourself to ask your question. Claire?
I'm a little confused. So, Curves requires
mics are up there, so if people on the phone can't hear the questions in the room, let us know by typing in on the little chat box, and we'll pass the mic around. So that's a good question, and I would actually turf that to the actual evaluating people. So it's one of those variables, right? It's one of those variables that we had to model in the sensitivity analyses that we did, is if curves complete, if you could pay per session, would that be different? Who knows? But it's a good question. And that's probably not. We don't know.
Yeah, I would say probably not, because the biggest driver was personnel and salary. So the cost
Right.
of the program itself was a relatively small part of the overall cost.
Yeah.
I have a question on instant message. So Diane is asking, how do you account for preference of lifestyle program choice?
Yeah, that's a good question. Thanks, Diane. And if everybody didn't hear from the back, how do we account for preference for the women who choose which? I'm guessing it's the preferences, which program did the woman choose to go to? And again, part of it was, we talked about before, part of it was geographic. Women around the state, we give them the options that are available within a reasonable driving distance to them. We actually do, one of the confounds could be that we pay for transportation. And so, we would make a woman aware that if there was a curves and she couldn't get there, that we could help her in her transportation costs as well. So it really depends on, how a woman feels like, the experience of going to Weight Watchers is entirely different than the experience of going to curves. And I think those are things that Siobhan and the other health coaches certainly take into account. Remember, all of this coaching and all of this motivational interviewing is going on one-on-one. So it's not like a woman's like, oh, I'm just going to pick this. She is having conversations with our staff about which choices may work better for her life. And so that's the other component that probably you wouldn't get in an economic evaluation, which is really the human piece. It's the connection.
I would just add to that as well, that question gets at the practical benefit of this kind of evaluation. So if you have a situation where a woman has a choice between those two programs, certainly you're going to encourage them to make the choice based on what fits them best. Whenever possible, you're going to encourage them to make the choice that's also going to be cost effective. And so you saw 5 times more expensive for curves. So when you can steer someone towards Weight Watchers, then the program saves quite a bit of money if you do that.
Right, but we didn't know that.
We didn't know it then, but now, so using the results, using the results would mean going forward that whenever possible, you steer towards more cost effective.
Yep.
Other questions?
This isn't so much a question, but a comment. It's so interesting because it's, in some ways, it's no big surprise, right, that our time is what's most expensive. Right. And it's the piece where I feel like, as an organization, is most invisible, right? We just, we're here doing the work, and we don't really scrutinize how we spend our time in terms of how it impacts the cost effectiveness of evaluations, probably in the way that we should. So it's just interesting to me that it's in some ways no surprise at all, but on the other hand, it's something we hardly ever, well, I shouldn't say we hardly ever, that might be exaggerating, but we don't probably pay as much attention to as we should as an organization.
Well, we almost never have proof of that, do we? We almost never have something you can point to and say, because our work is often unique, we're often the only people doing the work that we do, especially in state government. We often can't say, and here's how here's how our time translates into work being done. Yep.
And I'll also say that the dates of this study aligned with the dates when I started working. So one of the very first things I did in my employment here 4 years ago was start to negotiate these curves contracts. And I was there was a whole thing, we were actually trying to partner with the state of Pennsylvania WISEWOMAN group to negotiate a nationwide curves contract. So there were hours and hours and hours of my time learning about what the heck we were doing, learning about working with another state. That actually ended up falling apart. We didn't actually end up with a national curves contract. We ended up with 7 individual contracts with individual providers around the state. So that's why at the beginning I was like, that number is so scary. But all of my time and Siobhan's time of setting up all of the systems in place, I imagine if we did this study, and we may continue to let this study run its course, that the interval is going to get smaller and smaller. And yet, Weight Watchers, the experience of the staff would say that Weight Watchers is just easier. Like, it's just easier and more efficient for us to order these vouchers, send them out. We're still doing all the same stuff. We're still talking to the women the same amount. We're still doing all of that, but the actual nuts and bolts of the work that we do is just easier in this way. So
now that you're in the maintenance phase versus the startup phase.
Exactly, yeah. What was always easier?
Working with them, particularly.
Working with Weight Watchers was always easier from the get-go, but we like to give women options. So as a program manager, would I say, oh, we're only ever going to do Weight Watchers because it only costs this much? I don't know, because it's really, our program is allowed to be so individual to the woman that I will look at it. That'll be a factor, but that may not be the only factor.
Other questions? Anyone on the phone have a question? Oh, yeah.
When you're doing a cost evaluation, do you normally compare two different things, or can you just do one program, or why did you decide to do comparison?
Yeah, you can do it either way. You can do two different ones. We did two different ones because we had two different ones, and they were essentially supposed to be accomplishing the same thing. So it was easy. It made it easy for us to consider them together, but you could also do it by itself, because if we had, for example, if we had just done this on Curves Complete, you may have looked at the cost and said, wow, we really need to figure out how we can scale this back. So you can do it either way. You can, if they're apples to apples, like Curves Complete and Weight Watchers, you can do as many as you want. If you really just want to know something about the effectiveness of one program, the cost effectiveness of one program, you can do that as well.
If you are allowing the evaluation to run its course a little longer, will you have the opportunity to follow up with the participants in the original study to see how they have maintained weight loss and if there's a difference between the two?
Yeah, I mean, that's part of the data that we collect for CDC, and I'm not just saying that because Diane's on the phone. So that is part of what we do every day. That's part of the program, is that we follow these members for as long as they stay enrolled in our program. And with a program like Weight Watchers, at some point when they've hit their goals, they actually end up with a free membership. So not to further confound all of the data in here, but at some point those women can actually remain Ladies First members, but we're not paying for their Weight Watchers. But is that a benefit? Like, so.
And so Nancy mentioned that we're putting together the application for the new WISEWOMAN grant, and so that is when we'll start doing the planning for the second iteration of this evaluation. And I think it'd be really valuable for us to spend some time talking with people that go to both programs, doing interviews with them to understand what their experience is like, so that we have some personal context for what we saw in the numbers. So I think that would be what we'd want to do to compare kind of the two different cohorts.
Do you ever factor in, you're providing the opportunity to offer choice, but you had to negotiate 7 contracts throughout the state, so there's a community value to the fact that these businesses are supported by us. Does that factor in at all as a community positive, instead of going with the national program that's cheaper and more efficient and been around forever? Buy local.
Buy local. So, you know, in my world and this is all my time is money, right? So where I sit, I may factor that in, because the flip side of that is that we know that women who go to Curves Complete have friends who also go to Curves Complete. So they meet women at Curves Complete who they say, oh, by the way, this great program is paying for me to go to Curves. Maybe you could be in this program. One of our Curves Complete owners was one of our best recruiters for the program. So, you know, the cycles continue to go around and around in that, and I don't know that we've ever looked at Weight Watchers and had that same effect of women who make friends at Weight Watchers who turn around people next to them and say, oh, this is how I'm paying for my Weight Watchers. It's a different dynamic than working out in a circuit gym with the person sitting next to you. So,
And
yet
that-
another,
that would be another reason why it'd be helpful to do a qualitative part of the study too, because if you just looked at the numbers, you'd say, why would you ever send someone to Curves? If we did a qualitative part, and the people that went to Curves consistently said they love the program, they know the person that owns it, they know the people that run the class, then that would tip the scales in terms of why Curves would be a value, a different kind of value for the program. So with this, you get strictly numbers, but when you start to build in the local context, then you can have a more complete understanding.
And remembering that because we talk to every person individually about their choice, that's kind of built in. I mean, we're not just sending these out randomly. Siobhan is getting that feedback, whether we evaluate that feedback or not. Siobhan and the other health coaches are getting that feedback and making those decisions with the women. So that's part of the piece as well.
You're touching on something that I was thinking about, having to do with small numbers. You don't really have a huge sample size. Years ago, I used to do an evaluation of the tobacco program here. I looked at various cessation counselors at different hospitals. One of the things you can see is that some people are better than others at their job. So even though they're working for Curves, maybe the Curves in Berlin is just stellar and the Curves in Bennington not so much. So how do you, moving forward, are you going to be able to look at that in any way, or?
Yeah, with the qualitative study, we could get at that in a more personal and kind of granular level. I guess I would say, and Siobhan, correct me if I'm wrong, but some of the Curves have actually closed, haven't they?
Right, exactly. We started with 7, went down to 5, and above 5, we're really only active 2. So it's really.
So the market takes care of that also. If they're not, if they're not doing a great job, recruiting and keeping people in, then they're not going to be around as much. And so if we were to start this study now, we would say, A, we have 5, and B, only 2. So then the Curves numbers stay small because of those kind of factors.
We start small.
Yeah.
And now actually we have one further confound. So recently we started allowing women to use the online Weight Watchers, which may take out some of that geography piece. And we just started doing it, and it's possible that that's something that in the next 5 years, hopefully if we get this grant for the next 5 years, we would evaluate that as well, maybe the difference between local in-person Weight Watchers. I'm sure Weight Watchers has done the study themselves, that's part of their evidence base, but to apply that to a small state with limited resources is sort of our piece of that puzzle.
And then we'd definitely be looking at the impact on having in-person support versus something that you just do online to see how that changed people's experiences. Any other questions? All right.
Awesome.
Thanks, everybody.
Thank you.
If anyone didn't sign in on the way in, sign in, sorry, that was